Hello everyone, I'm Anas Al Ubaidi, and the title or the topic for this lecture or session is defining the CMAA's Certified Medical Administrative Assistant's role in modern healthcare within the chapter that is covering the foundations of excellence in healthcare administration within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. The Certified Medical Administrative Assistant, CMAA for short, is a pivotal professional in modern healthcare, bridging the gap between administrative efficiency and optimal patient care. At its core, this role ensures the seamless operation of healthcare facilities by managing complex administrative tasks while creating a patient centered environment. To fully appreciate this position, it's essential to understand how healthcare has evolved. Increasing demands for better patient experiences alongside advances in technology and complex regulatory protocols have placed administrative roles at the forefront of healthcare delivery. Key points. Core responsibilities of a CMAA. CMAAs manage a wide range of tasks that ensure the smooth functioning of healthcare facilities. Their responsibilities include, but are not limited to, scheduling patient appointments, ensuring accuracy, reducing wait times, and coordinating with healthcare providers, managing medical records, organizing, updating, and maintaining electronic health records or electronic medical records, EHRs or EMRs, to meet HIPAA compliance and HIPAA compliance, HIPAA and USA. Insurance processing, verifying patient insurance, handling pre-authorizations, and ensuring claims are correctly filed. Billing and coding coordination, assisting medical billers with correct documentation and coding processes to prevent denials. Communication management, acting as the primary point of contact between the healthcare provider, patients, and third-party entities. In other words, a CMAA, Certified Medical Administrative Assistant or Medical Administrative Assistant, scheduling weekly physical therapy sessions for a patient recovering from a knee replacement ensures there is no overlap with other consultations while confirming insurance coverage. And this is example can be considered as an example. And here is a diagram showing the comprehensive CMAA responsibilities. From scheduling appointments to managing medical records to insurance processing to billing and coding coordination to communication management. Essential skills for CMAAs or MAAs. To perform effectively, CMAAs need a blend of technical knowledge, administrative expertise, interpersonal skills, and adaptability. Key skills include proficiency in EHR software, uh, electronic health record. Platforms like Epic, Cerner or Kerner, or Meditech are essential for handling patient records. Knowledge of medical terminology, interpersonal communication, and regulatory understanding. Regulatory understanding, and this example would apply to USA. Familiarity with HIPAA, OSHA, and other compliance requirements ensures legal adherence, and whatever relevant or equivalent in any other healthcare system in another geographical area or location or country. And here is a diagram on key competencies for CMAAs in healthcare settings. Now, AI, a skilled CMAA or MAA using their knowledge of EHR systems, can quickly retrieve patient information for a physician or clinician, preventing delays during emergencies. This can be example of how to apply skills right here. Elevating beyond routine tasks, CMAAs often step up to roles that directly impact patient care delivery by improving workflows, identifying administrative bottlenecks, and enhancing communication across teams. A CMAA can become an indispensable part of the healthcare team. This requires critical thinking, proactive engagement, and leadership skills. AI, i.e., when a clinic experiences a delay in patient flow due to a scheduling backlog, a CMAA might analyze patterns and implement an overbooking strategy during peak hours to reduce downtime downtime and improve provider productivity or clinician productivity. And this is an example. And here is a diagram on how to improve patient flow in a clinic. Contributions to the larger healthcare system. CMAAs are instrumental in maintaining operational efficiency, which is a foundation for any successful healthcare facility. They directly contribute to reducing patient no-show rates, ensuring reimbursement accuracy, enhancing patient satisfaction, i.e., a CMAA who explains billing inconsistencies to a confused patient not only resolves the issue, but also fosters trust and encourages long-term loyalty. And this is also an example on how to applying this key point. And here is a diagram on CMAA's role in healthcare efficiency. Application examples. Here's an updated detailed overview of 10 real-world applications of CMAA skills, showcasing how their expertise is integral to modern healthcare operations. Each IE is broken down to provide clear scenarios, step-by-step execution of tasks, required tools or resources, and the resulting impact. Scheduling emergency patients. Scenario: a patient referred from emergency department urgently needs a follow-up consultation with a specialist. The day's schedule is already full for the clinic. Step-by-step execution as a CMA accesses the clinic scheduling module within the EHR system, analyzes the current schedule, identifying any potential openings or cancellations, collaborates with the treating physician or provider to prioritize the emergency case and adjust the day's schedule. Contacts other patients with non-urgent appointments to offer rescheduling options, explaining the necessity. Finalizes the updated schedule, ensuring the appointment is added with all the required details. Tools/resources. EHR system with a flexible and dynamic scheduling functionality. Triage urgency protocols from the referring emergency department, communication templates for rebooking other patients. The impact. Here, the CMAA ensures timely follow-up care, preventing delays in the patient's recovery. This supports better patient outcomes while maintaining a well-organized clinic workflow. Managing insurance pre-authorizations. Scenario: a patient requires a high-cost procedure, i.e. MRI scan, example. But their insurance policy mandates pre-authorization to confirm coverage. Step-by-step execution. The CMAA reviews the provider's clinical notes and diagnosis codes to determine the procedural justification. Logs into the insurance company's portal or contacts their representative. Inputs necessary medical data, including ICD-10 and CPT codes, and attaches supported documentation from the physician or the clinician. Follows up with the insurer to ensure no delays in processing and resolves any issues flagged during review. Tools/resources, ICD-10 and CPT codes guide, insurance portal or dedicated pre-authorization software, communications via secure phone or email systems. Impact. The CMAA minimizes procedural delays and ensures financial coverage for the patient. This alleviates patient stress and prevents revenue loss for the practice. And here is a diagram on insurance pre-authorization process. Improving no-show rates. Scenario: a clinic has identified a 30% no-show rate, significantly disrupting workflow and reducing revenue. Step-by-step execution uses analytical tools to assess no-show trends, identifying common patterns, for example, certain demographics or appointment times. Implements automated reminder systems that send text, calls, and emails 24-48 hours prior to before the appointment. Follows up personally with high-risk patients, offering to reschedule or address transportation challenges. Regularly monitors the effectiveness of reminder methods and adjusts the approach as needed. Tools and resources. Appointment reminder system/software, data analytics tools to identify trends, communication training for patient outreach. Impact adjustments result in a significant reduction in no-shows, improving efficiency, patient care access, and clinic profitability. Coordinating multidisciplinary care. Scenario: a patient with newly diagnosed diabetes requires consultation with endocrinology, ophthalmology, and dietetics specialists, dietitians. Over the next month. Step-by-step execution gathers the patient's availability and shares it across departments via interdepartmental communication platforms, coordinates the sequence of appointments to avoid unnecessary travel for the patient, confirms insurance coverage for all scheduled visits, provides the patient an organized itinerary, including pre-visit instructions for each department. Tools/resources, interdepartmental scheduling tools like EHR integrations, insurance verification software, printed or electronic patient instructions. Impact: ensures cohesive care delivery across specialties, enhances patient satisfaction, and prevents overlaps or missed appointments. And here is a diagram on coordinating multidisciplinary care for diabetes. Patient data auditing. And here's a diagram on patient data compliance process. So scenario here, during a routine compliance audit, files are reviewed for missing patient consent, forms, or signed HIPAA disclosures. Step-by-step execution, the CMAA pulls a predefined list of patient files flagged for missing documentation using the EHR system, reviews each file for discrepancies and validates the accuracy of uploaded documents, contacts patients to rectify omissions, ensuring proper consent is obtained, updates the records, and generates a summary report for compliance officers. Tools/resources, EHR system with document tracking functions, training and compliance regulations, for example, HIPAA, secure patient communication methods, example, certified email. Impact: prevents potential legal or financial penalties while ensuring patient privacy and rights are safeguarded. Assisting telehealth policies. Scenario: patient residing in a rural area needs to consult a specialist located in another state via telehealth. Step-by-step execution verifies the specialist licensure to provide care in the patient's state, confirms whether the patient's insurance supports telehealth services, and ensures billing codes are up to date. Schedules an appointment with the telehealth platform's guidelines, providing the patient with instructions for accessing the session. Troubleshoots any technical issues pre-appointment to ensure smooth connectivity. Tools/resources, telehealth policy, guidelines from state boards, secure HIPAA-compliant telehealth platforms, patient IT support resources. Impact: allows patients in underserved areas to receive specialized care, bridging healthcare gaps while adhering to legal and insurance policies. Streamlining patient check-in processes. Scenario: during peak hours, patients experience prolonged waiting times due to manual check-in procedures. Step-by-step execution implements self-service kiosks or tablet-based check-in systems integrated with the clinic's EHR, electronic health record, trains patients on usage, providing staff support when needed, optimizes the check-in workflow to integrate with the subsequent front office operations like insurance verifications, monitors the performance of the systems, and collects feedback for improvement. Tools/resources, self-service kiosk hardware and software, integration modules for EHR systems, patient satisfaction surveys. Impact: significantly reduces waiting times, improves patient satisfaction, and frees up staff for other critical tasks. Handling patient grievances. Scenario: a patient receives a higher than expected bill due to discrepancies in insurance coverage and is visibly absent. Step-by-step execution, the CMAA listens to the patient's concerns empathetically and gathers relevant billing details from the system, reviews codes and charges, identifying errors or misunderstandings in communication from the insurance provider, collaborates with the billing team or insurer to resolve the discrepancy, updates the patient with the resolution, and ensures corrections are applied, providing follow-up as necessary. Tools/resources, CMR or billing systems, knowledge of insurance and coding processes, effective communication and conflict resolution training. Impact helps maintain patient trust and satisfaction while ensuring clinic financial integrity. Ensuring HIPAA compliance with communication. Scenario here, a clinic starts sharing patient records electronically but discovers risks in current communication practices. Step-by-step execution implements an encrypted email system for staff communicating sensitive patient data, conducts staff training sessions on the importance of data privacy and HIPAA requirements, reviews compliance checklists and monitors communication for adherence to protocols, files annual HIPAA compliance documentation to regulatory bodies. Tools/resources, encrypted communication tools, ongoing compliance education programs, HIPAA compliance checklist templates. Impact ensures patient data security and avoids costly penalties for breaches. And here's a diagram on ensuring HIPAA compliance in clinics. Organizing clinical reports for physicians or clinicians. Scenario: a physician requires organized lab reports, imaging results, and previous consultation notes for reviewing a patient's complex disease history. Step-by-step execution: access the HR system and filters relevant reports for the patient, arranges the reports chronologically or by diagnostic category based on the physician's preferences, prints or digitally compiles the document for ease of review during consultation, ensures any missing reports or pending labs are flagged and expedited. Tools/resources, filter and search tools within the EHR, electronic health record report compilation templates, direct communication with labs or diagnostic departments. Impact streamlines the physician's workflow, allowing accurate and efficient patient evaluations, ultimately improving patient outcomes. And here's a diagram on streamlining clinical report organization. Summary tables next. Here, table on care responsibilities of our CMAA, table on essential skills for CMAAs, table on applications and patient care delivery, table on contribution to operational efficiency, and table on CMAA tools and their uses. Next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Which of the following is not a core responsibility of a certified medical administrative assistant, CMAA? A. Scheduling patient appointments. B. Managing EHR. C. Diagnosing medical conditions. D. Verifying insurance coverage. Definitely it's C. It's not. It's out of the CMAA's or MAA scope of practice. So C is the answer. Question 2. What is the primary purpose of implementing an automated appointment reminder system within a healthcare facility? A. To replace the CMAA's job entirely. B. To reduce patient no-show rates. C. To send marketing campaigns to patients. Or D. To monitor patient health outcomes. Definitely it's B, the answer, reducing the no-show rates. Question 3. What tool is critical for ensuring compliance with privacy laws when sharing patient information with external providers? A. Unsecured email systems. B. HIPAA-compliant encrypted platforms. C. Social media direct messaging. Or D. Physical mailing of medical records. The answer is B. Question 4. Which skill is most essential when a CMAA is handling a patient grievance related to billing errors? A. Conflict resolution communication. B. Advanced coding certification. C. Knowledge of clinical procedures. Or D. Marketing and sales knowledge. A would be the answer. Question 5. Why is critical thinking considered a key skill for CMAAs when working in modern healthcare? A. It helps keep the facility's computer systems running. B. It enables CMAAs to automate all their tasks. C. It allows CMAAs to proactively resolve or solve bottlenecks in workflow inefficiencies. Or D. It reduces the need for collaboration with other departments. The answer definitely is C, as it allows CMAAs to proactively solve bottlenecks and workflow inefficiencies. And here we come to the end of this lecture. Thank you very much and goodbye.